Hello everyone, Dr. Fakhra here, gynecologist, and I am here again with a new video that is in English versions. The only reason is that English is a language that we had a great outreach, and lots of people, despite of different local languages or regional languages, they're able to understand English. So it will be beneficial for the people in country and outside also. So in the last video I had talked about the cancer screening in women. So it means the cancer screening for the reproductive system cancer. So what it means? Reproductive system means uterus, cervix, tubes and ovaries. So thing is that everyone will not be having any symptoms. So what are these the screening methods? Screening methods are the methods which will help you to diagnose your cancerous conditions much days, even years before they will develop. In the pre-malignant stage, it means that cancer has certain stages. It will pass through certain stages and then it will turn up into cancer. So before you develop cancer, before that, how can you find that you are prone to develop cancer in later part of your life? That's why the screening methods are very important. You must heard about this cervical pap smear. So what is this cervical pap smear or liquid based cytology, the new advanced now? It is basically the cells that are taken from the discharge of the cervix. So what is cervix? Cervix is the lower part of the uterus. That can also turn into cancer in some of the women. You know that cervical cancer is one of the most important cause for death in women. And we can easily diagnose the early stage or the pre-malignant stage by the cervical pap smear. What you have to do is to go to the lab with a prescription, and they will take the discharge from their vagina and they will form a smear, that is slide, and they will try to find whether there is any abnormal cells or malignant cells are there or not. You know what the important reason for death is? We miss the diagnosis. Late diagnosis, advanced cases of cancer, when it has already spread to other structures or brain or lungs, then we cannot save the patient's life despite of giving the all advanced treatment. Just think of it. Just be careful of yourself and you will be able to save your life from cancer. And have you heard about the HPV vaccine? It is there for a long time, but very sorry to say, acceptance is very poor. We spend lots of money for the vaccination of the children but we don't want to ponder what is the vaccine for the prevention of this cancer. Yes, this is a HPV vaccine given to the girl aged 9 to 12 years. Just 2 doses are enough. And after that, before marriage also, you can be given and in the 3 doses. So you ask if sometimes, can a mother or woman who have given birth to a child can get the HPV vaccine? Yes, you can definitely get, and you should always get. Lactation is a time when they generally come for the consultation with a gynecologist. That is the time generally we ask them, please get this vaccine. This is a life savior. If you are able to save your life from this cancer 99%, then why you should not be getting it? Think for it before you say no to it. And then you have to find out this alarming sign for the cancers. Suppose you have reached 40 years and your bleeding is there irregular. Irregular means you are not having proper cycle. In between the cycle also, suppose you have bleeding, spotting, bloody discharges from vagina, heavy bleeding, you need evaluations. This simple transvaginal sonography will give a lots of idea what is their problem in the uterus. And suppose we find that the endometrium, that is the inner layer of the uterus, is thick, we go for the biopsy. And these two technology will help us to find us this endometrial cancer, that is a cancer of the uterine layer, very early stage. An early stage diagnosis, just going for the surgery is enough. Maybe we will not need any chemotherapy or radiotherapy for that. Just think of it, how you neglect yourself, bleeding, and you're staying at home, and then you are diagnosed with advanced stages of cancer, endometrial cancer. So again, this is a question to ponder. How much thoughtful you are for your own symptoms. How much you get alert with the alarming sign of the irregular bleeding. Now, suppose you have reached menopause. Menopause means periods have stopped for more than 6 months. But after that, again, suppose you start bleeding slowly or irregularly, or spotting or watery discharges with the blood. You have to go for the very good transvaginal sonography, and endometrial biopsy is must for such cases to diagnose this endometrial cancer. So after menopause, after the period has stopped, suppose the bleeding is there, you have to go for the evaluations. You just can't sit at home and think that everything is fine. And those women who are diabetic, who are hypothyroid, and they have the family history of this cancer, especially the ovarian cancer, they should go for the regular ultrasound of the lower abdomen. That is combination of the lower abdomen ultrasound with transvaginal sonography. You know what? The ovaries where the eggs are formed. We are still not able to find the early stage cancer of the ovarian cancer. The reason is that because the ovarian cancers are asymptomatic. They don't produce any symptoms, maybe just pain or vague pain or nothing else. In that situation, we miss the diagnosis. We tell, please get an ultrasound every year. Every year, just simple ultrasound by nearby sonologist is enough. If the ovaries are enlarged, definitely we will go for this surgery and removal of the ovarian mass. So just think of it, most of the time you neglect your symptoms of this abdomen pain as acidity, pain of acidity or gas or constipations. But it's not always the case. We have seen the cases of ovarian cancer in the advanced stages, when ovaries, which is just 2 centimeter structure, become so much enlarged, just like a football or much more than that. And you think that you are getting obese or you are getting fatty, and you sit at home, because of this age I am getting fatty, and that's why the abdomen is swelling. It's too late, dear, to diagnose this. It's too late, and despite of all our interventions and our treatment, we are not able to save the lives. As from us, we have seen only these advanced cases of the ovarian cancer. So in these situations, you have to be very alert. And last but not the least, breast cancer. Just go for these breast examinations. Now, these early stages, we have diagnosed of the cases of the breast cancer. Earlier, it used to be above 40 or 50. Now, I have seen the cases of 30, 35 years old women having a small lump, and it turned out to be breast carcinoma. All you have to do is just go for the breast examinations. And if you find any suspicious, consult the doctor. Just by simple ultrasound or mammography, we are able to find whether there is any problem in your breast or not. And the diagnosis is by the crooked biopsy in the most of the cases. So be alert. Your life is very important, but you can preserve your life and be healthy by being alert. Be alert to your alarming signs. Don't just ignore yourself. And thank you so much. Please keep watching our next video.